What is up, everybody? It is Steve the Hurricane here, live with you from my base of operations in good old Manalapan, New Jersey. And I hope that every single one of you is having a fantastic summer. I also want to welcome you to this webinar because this webinar today, as crazy as it sounds, and I know that some of you who've been following me for years, you know I always do a finish whatever year it is strong webinar. And it's early for me to do a finish 2023 webinar, but it's not like, I can't believe that 2023 is more than half over. Like, oh, it's July 18th of 2023. Next week will be the last full week of July before we have to get into August. And then before you know it, the kids will be back at school. Before you know it, Labor Day will be here. Before you know it, everyone will be back from their vacations. And then it's pop time. You know, something that I can share with you before I even share my computer screen and everyone's gathering on here. And I literally, at 12 noon today, so 3 hours ago, I had a call with members of my Home Care Elite Academy. And I was talking to them about planning for September, October, November, December, because the last 4 months of this year, for every single one of us as a home care business owner, can be explosive. You can generate in those 4 months more than you did in the first 8 months of the year if you plan it out properly. So what I love about the title of this, and the reason why I'm calling it Finish 2023 Strong, is maybe the year is half over and you didn't have the first half of the year that you thought. Maybe with the year being half over, things aren't going according to plan, right? Maybe I'm running out of PPP money. Maybe I'm running out of ERC money. Maybe there's some challenges going on in the business. The economy is changing, right? And so now it's harder to sign up business than it was before. So I'm going to share a lot of these trends with you live during this webinar. I'm also going to reward you for being live with us. I always want people to be live, right? There's 300 people total for the webinar, but not everybody watches it live. Some people will watch the recording later on. Well, for those of you who know me, you know I always give away something for free. So I'm going to give away a $1,000 item at the end of this webinar. So if you're live with me right now, I want you to know at the end of this webinar, I'm going to give away a $1,000 item to help you in growing your home care business, because I know what you do. You are taking care of seniors, and if you're taking care of seniors and you're doing a good job at it, I want you to take care of more people. It's as simple as that. Keeping our seniors out of hospitals, keeping our seniors out of nursing homes, that's the goal. Obviously, sometimes people may need to go to nursing home. I get it. But if somebody has resources and they want to stay home, we should be able to meet that person where they need, especially, you know, when I always think about our elderly. You know, so many of them are veterans. They worked their whole life. Now is their time of greatest need. I want one of you to give them the support that they need. So I want to thank you all for being here. Let me go ahead and share my computer screen. Can everybody see my computer screen? I think you can. And where it says questions, if you want to just type yes, if you can hear me, type yes where it says questions on the GoToWebinar little control panel there, if you can hear me. I always ask this because I just want to make sure everybody can hear me. Oh, good. All these, and I love to see the people on here. Oh, Brittany. Brittany, I love you. You're like, I don't know when Brittany works. Brittany is always on vacation. I kid. I love you, Brittany. You know that. Look, we got Andre on here. I haven't seen you in a while. Hope you're doing well. Yes, Manalapan in the house, Michael. Got to hold it down there. We got Connie and Kimberly and Barbara and so Daniel and just so many other people on here. So this is fantastic. I'm glad everyone can hear me. So we're all set here. So everybody can hear me. At any point in time, if you have questions, just type your questions in there. I will answer your questions, but to be courteous to everyone, I will answer the questions at the very, very end when we're all said and done and finished, all right? So everybody knows how to communicate with me. You can type it in the questions there. I will answer the questions at the very, very end, all right? And then let's go ahead and get started here with the 5 steps to finish 2013 strong. Part 1, because part 2 is coming in September once the going gets tough, all right? And so first things first, as we go through this, there we go. Want to give a quick shout out to all of the sponsors for the upcoming Home Care Evolution Millionaires Boot Camp. This webinar is brought to you by all of these companies. So every one of you either received an email from me or from somebody who's on this screen right here. So I want to thank them for their sponsorship. I want to thank them for helping to promote this webinar. And I know you're going to get a lot out of this. And the reason why I know you're going to get a lot out of this is because of the way that I'm going to do this. I'm going to actually pull up a lot of information from the most recent Home Care Pulse report. And what I love about the Home Care Pulse report so much, right? And I'm actually holding it right here in my hand, right? This is pieces from the Home Care Pulse report. We get the cover. There you go. So I'm holding it, right? What I love about the Home Care Pulse report is this is information, right? It's information, it's accurate data collected from about 1,200 to 1,500 locations around the country. They also did something new this year where they added the home health and the hospice counterparts. If you want to get a copy of this, you can actually use my company's initials, HCE, and the number 600 to save half price off of the full price of this. So HCE 600 will save $600 or half price off of the report there. But what I love about the data is just data, right? The numbers don't lie. And it's what you do with the data, that's how you can determine how to be successful and see what other people are doing who are more successful, see what I'm doing right and what I want to continue to do and where I need to make some tweaks and changes. That's what I love about the Home Care Pulse report. And a lot of people understand that, but some people don't understand all of it. And that's where I bring you this industry-wide expertise with the Home Care Pulse data, all right? Something else I want every single person on this webinar to know, if you have not registered for this event, my goodness, get on the program, all right? My website, the Home Care Evolution Millionaires Boot Camp is November 15th, 16th, and 17th, all right? It's gonna be in San Antonio, Texas. This event is going to sell out. If you've been to the Millionaires Boot Camp before, come to this one. Why do I want you to come to this one? Because the entire presentations, every presentation that I've done and other presentations have been reformatted on how to execute it in 2023, relevant to right now. Plus, if you've all been getting this, the magazine, I'm going to announce right now one of our guest speakers, which I'm so excited. In the magazine, you've all probably read it by now. I know we've already had like 10,000 viewers on our website for the magazine in the last couple of weeks. This gentleman right here is a good friend of mine from church growing up. He also happens to be a captain in the United States Navy, and he's a doctor. Being a captain in the United States Navy and being a physician, he actually works at the Pentagon, and he is going to be leading a session talking about what veterans are looking for in care and how to better serve our active military and our veterans when they need care from us. This one presentation that he's going to be delivering alone is worth the cost of coming to the event. This man literally helps to make procedures that are dealing with active military and policy for our veterans. You need to hear this event. You must come to this boot camp. Just saying that right now, all right, because it's very, very important. And plus, I mean, again, you get the chance to meet a naval captain who works at the Pentagon making policy on procedures and whatnot. And it's just one of the amazing guest speakers that we have at this event, so you must be there. All right, I'll talk about some of the presentations later on, but let's get to the meat and potatoes, all right? So everybody come to the boot camp. Now, that being said, thank you to the benchmark study. We've already talked about that, so let's move forward. The first thing I want to take a note at and take a look at, all right, is your profit and loss statement. This is something that if any of you who followed me for years, you know, members of my Elite Academy, people who've been to boot camps, you know I talk about the profitability of the business. It is not from a place of greed. It is from a place of the ability to be able to grow the business. And most business owners, right? Most business owners out there, all of you who are listening to this right now with me, there's usually a certain amount of money that we take from the business for ourselves, and then there's money that we take to reinvest in the business. This is the reason why you should have a 20% profit margin, because ideally 10 to 15% you should keep for yourself, and you should reinvest 5 to 10% in the business to be able to grow. This is where people can get promotions. This is where people can get raises. This is where you can hire more staff. This is where you can expand into new territories, maybe buy your own building, get a better office space. There's so many different things that you could invest in other revenue streams through the same type of a business. I'll actually talk about that later on in this webinar here. But if you're operating at 10% profit margin or less, you don't have the ability to do that. And that is problematic, because if you're looking at the screen here, you may be like, all right, Steve, what does this all mean? All right, so it's kind of hard to see. So let me just go ahead. I'm gonna back out of this for just 1 second. I'm gonna end the show. I'm gonna pull up my actual calculator live real time with you, and I want to show you what the numbers are. All right, so we're looking at this right here. Everybody can see this, right? And I'm just going to take a look. I'm going to share with you the middle of the pack, because what I love about Home Care Pulse does a really good job of breaking things down by business size and structure, and it does make sense. You know, for example, over here, you see where my mouse is, and I'm moving it right now. You see it says the masters, right? If you're doing over $5 million, by government IRS terms, the amount of revenue you're generating, you're no longer a small business. You are actually considered a mid-sized company when you're doing over $5 million. You probably employ more than 50 employees and all these other. So by every definition, if you're doing over $5 million, you are a master of the home care space, right? So I love when they show the masters here, but then they also break it down. Like, say you're brand new, or maybe you're struggling, right? And you're doing less than $800,000. So there's a different category over here for you. And so what are you and your peers doing? So I like the way they break it down. But for all intents and purposes, I'm just going to go with the middle of the pack, because let's be real here. In any other industry, if you had a small business that was doing $2 million in revenue, you should be making over $400,000 in revenue for yourself as profits. That's 20%. In any industry, you open up a McDonald's, you open up a restaurant, you open up a dry cleaners. I don't care what the business is. If you're doing $2 million in revenue, you should have $400,000 or more left over as profit when all is said and done. That's 20% or greater, right? So let's just see what the middle of the pack sized agency, 1.5 to 2.5, which you see the average person, I'll make this a little bit larger so everybody can really see it, okay? The middle of the pack agency right here is doing about $2 million. What is their profit margin? Well, okay, let's pull it up. So for all things direct care associated, right? Everything that goes to the wages of your caregivers. At this level here, that's 61.3%. So I'm going to round that one down. So 61%. Now, back over here, this next section, everything associated with the recruitment and the retention of getting a caregiver. All right, everything associated, including team wages associated with recruiting and retention of professional caregivers, right? So all things included, this is 3.1%. So I'm going to add my 61% plus a solid 3. I'm not going to do the next number yet. That's 64% of my revenue before anything else. That's just the gross profit, right? Caregivers, compensating them, and what it costs you to get caregivers. Let's move up. Let's talk sales and marketing. Let's be real, folks. Every one of us is a business owner. We know it takes money to make money. The Small Business Administration, the SBA, recommends that you spend 7 to 8% of your total annual revenue on all things sales and marketing. By the grace of God, every one of us is fortunate enough to be in healthcare, where having a good reputation and being around for a while really helps to reduce the cost of advertising and marketing, because word of mouth will spread, and our industry is one that word of mouth is very, very strong. I'm actually going to show you some points in a second talking about this. But instead of spending 7 to 8% like the rest of other businesses, we're spending 4 to 5%. So this 4.2% is a solid, good number. All right, so 64 plus another 4% for sales and marketing, that's going to give us 68%. Okay, now is where it really comes down to where it really hurts, and this is the other operating expenses. Our rent, the office staff, the people who work for us that we see every single day, that we would not be able to work our business without their help. Executive wages, if you happen to have an executive director, but note what it says, excluding owners, so not your salary, but executive people who work for you. Software, if you belong to a franchise, hey, I love all the franchises. They help you and they get their cut, right? So it's all factored in here. This is another 22.3%. Since I rounded down on all the others, I'm going to round up to 24% on this one here. And we add 23%, sorry. That's 91%. 91%. That means that if you did an industry average for this point, whoops, went way too far ahead. If you did an industry average, 1,990,000, $1,990,000 times 0.91, so that's 91%. That means that you spent $1,810,000. That means that you're left with $180,000. And while $180,000 is not a bad income, all right, that's not 10%. That's not 20%. There's nothing left over. So when your scheduler says, boss, I'd like a raise, where's it coming from? Your recruiter says, hey, I'd like a raise, where's it coming from? So you know what happens? They quit, they leave you. You lose 3 months trying to replace them, get the new person up to speed before things start growing again, and you're stagnant. This is the problem with our industry. And I'm very concerned because it's been 2 years in a row that the number has been less than 10%. That's the industry average. Let's just for all intents and purposes, let's just see what the best of the best is doing, the masters of our industry, right? So the masters of our industry. Well, I'll just round down and I'll round up later, right? So 63% to the caregiver. Whoops. Clear that out. All right, 63% to the caregiver, 2% to getting caregivers, 2% for marketing, and then I round up the last one, 21% for operating expenses. Whoops, I did that wrong. Let's do it again. Plus the 63, that's where I was missing, right? They're at 86%, which leaves them at 14% profit. Now, 14% on $10 million is $1.4 million. I think that they're okay, but I still would like to get them closer to 20%, right? Because then they could open up and become a more of a regional provider, or they could expand to new states and do multiple. I have some clients that are doing 10, 20, 30, $40 million a year in revenue, and they're expanding into other states with the revenue that they have coming in. But even still, 14% profit is not great. It's better than the industry average. This is the reason why you're here. This is why I got you covered. This is why I'm doing this to make a point, but I'm doing this to show you that we can overcome this, but we have to do a little bit of things to be able to make it happen, all right? So the first thing we got to do is we got to take a look at what our revenue per caregiver is, all right? Our revenue per caregiver has been going down. What does this mean? This means that if I hired a caregiver today, right, that caregiver during her time working for my company, she will generate this much money. And there's a huge variance between everybody else and the masters. I mean, even the group right before the masters, like if you're doing $4 million, you're almost a master, but somehow, some way, the masters are getting 20%, 25% additional revenue from their caregivers, right? And it just goes up on this sliding scale until you get down here. And even the masters, I feel we could do better, but I understand, and I'll take this as this is the least we should do, all right? And so what you do, and it tells you right here, here's how you can calculate this for yourself. Take the revenue per professional caregiver by dividing your total annual revenue by the number of caregivers employed in the same year. Example, we did $1 million last year and we employed 100 different caregivers last year. That equals $10,000 per caregiver. That's the quick, easy way to do it. So what was your revenue divided by the total number of caregivers you had employed last year? That gives you your revenue per caregiver. But this is the biggest problem with our industry right now. We're not keeping our caregivers, because think about it, if a caregiver is only generating $13,000, knowing that we're paying 60%, that means 7,000 is going to the caregiver as compensation and 6,000 is coming into the company. That's a very short period of time that caregiver is working for us. It's almost like one caregiver to one client. In some offices, you may have an average of 2 caregivers to one client because their turnover is so high. So how can we address this? What can we do? What is the takeaway? How can I turn this around in the second half of the year, Steve? The easiest way to do it is by having a 20-hour minimum. I have said this so many times over the years, and I can tell you, every single one of my clients who does the 20-hour minimum retains their caregivers, and their caregivers generate significantly more revenue per caregiver on average than people who do not. It is as simple as that. And the reason for it is work-life balance. So you have to ask yourself this, and this is the reason why it is what it is. The Home Care Pulse many years ago did a survey where they were actually talking about the top 10 complaints of caregivers, and beyond compensation, like beyond money, because everybody thinks caregivers want to make more money, and they do. But the number one complaint of caregivers is inconsistent hours. That's the number one complaint. And so when you think about it, and I'm going to share a book that I think everybody should read. If you're a client of mine, you know I talk about this in the Momentum course, right? Every single one of you should read this book. It's called A Framework for Understanding Poverty. Cognitive Approach, Dr. Ruby Payne. She is a phenomenal author. The research that she did, she put together, it's a quick read, 170 pages, big font. You know, you have to read this book. The reason why we have so many issues with our caregivers comes down to one simple thing. We are placing middle-class expectations on a poverty compensated employee. Simple as that. That's where all the issues come from. That's the reason why the turnover and everything else, because at the end of the day, you have to think about the caregiver's perspective. These caregivers are living paycheck to paycheck. They're actually under living paycheck to paycheck. Like, they don't make enough to live, but let's just stay at that. I'm not talking about raising rates. I'm not talking about raising rates. Just understand your caregivers, their mindset, right? They don't make enough money to live. As soon as we don't give them full-time work, they have to, out of necessity, look for work elsewhere. So if we give them a case that's 16 hours, that's going to make it very hard to find a case that's going to be 24 hours to make up the other 40 hours. It's going to be very difficult to do that. By having the 20-hour minimum, what it allows you to do is give 2 20-hour cases or 40-hour cases, 1-to-1, maybe 2 clients to 1 caregiver. That's much easier to maintain. Someone who's working 40 hours a week full-time is not actively looking for another job. That equals retention. All right, so that's the best tip of advice I can give you. And now, in order to do that, though, because here's the catch, right? Here's the catch, because people say this to me all the time, Steve, I'd love to change, but then I don't have enough people calling me. I don't have enough leads. I don't have enough leads. So where am I going to get the leads? Well, you've all heard me probably talk about the nerd customer, and I mention the nerd customer all the time for a reason. A nerd is somebody with great need, elderly, with resources, disabled. It's a 4-part customer, nerd, right? In order to get the nerds, you're going to need to have a strong marketing department, which is the first of the 5 tips I'm going to share with you. Looking at this, as you see on the screen right here, these are, oh, you don't see on the screen right here. Ha, ha, ha. You will see on the screen right now. Right? All right, so now you see it on the screen here. So looking at the screen right here, I got on my soapbox there, read the book, all right? It's a good book, trust me on it. But now over here, so the best referral sources, I already told you, word of mouth is gonna be your best. But if you haven't been around a while, you haven't established word of mouth, or you have a bad reputation, you have to overcome that. So now when you look at this, aside from Medicaid, if you're not a Medicaid business, or a lot of people, like I'll tell you, like 1/3 of all of the inquiries that we have, I had over 5,000 people this week come to my website. This week, because of the magazine, right? Reading the magazine. The third most type of clients who are contacting me for services are people who own Medicaid businesses and they need to get more private pay because it's too imbalanced. They have like 90% Medicaid and like 10% or less private pay, and they want to grow it to 50-50, which is something that I recommend, because when you grow it to 50-50, then it allows you to have extra profits from the private pay to weather any regulation changes from the government on the Medicaid side of the business, right? This is super, super important. So Medicaid is the number 2 source, but look at the rest of this list. And this is straight from the masters. This isn't just everybody. This is the best of the best in the industry. It is all about 2 different ways to get your nerd patients: direct referral marketing and internet leads. It is as simple as that. Everything else is irrelevant. Don't put the ad in the blue book. Don't spend money on the radio. Don't spend money on television. No billboards. Direct referral marketing and internet leads. 1-2 punch. That's all you got to do to generate the nerd referrals that allows you to have the 20-hour minimum, because that's the key. It's a 20-hour minimum. I've been doing this for 11 years, 12 years. 11-year anniversary was a couple of months ago, last month. 12 years I've been doing this. More than $1 billion generated for my clients. 20-hour minimum is the key. In order to do that, you need an abundance of referrals. You've all heard me say referrals equals what? Freedom. Referrals equals freedom. This is, I'm not just saying this, right? This is Home Care Pulse. This is where you're going to get the referrals so that you can bring in the 20-hour minimum cases. And I'm going to be straight with you. Every single one of my clients who's featured in all of these magazines that I just keep pulling up. You see this one? Look at Rochelle. So beautiful right there on the cover, right? And this one, and I just go on and on. All these magazines that everybody's been receiving and reading, every one of them has a 20-hour minimum, and their businesses are growing, and they're able to keep caregivers longer than the industry average. Not forever, but longer than the industry average. But that's how you scale. That's how you grow. That's how you also get to be the employer of choice, and caregivers want to work for you. What happens is, the word on the street is, this is the agency that has the good cases. That's how your caregivers talk about you, right? Now, the reason why I have these 2 companies here is because these are the 2 companies that are best served to help you. So if you come to the boot camp, you're going to meet Jeremy, who is a speaker that I will say rivals myself as an eloquent speaker. He delivered an amazing message at the last one on AI taking over and stuff, and how to integrate AI with your ads and everything else. The funniest joke that he said at the last one, which cracked me up, he goes, "Where do you hide a dead body?" That's what he said. He goes, "Where do you hide a dead body?" And everyone's like, "Oh no, in the back trunk, like you bury it, you know." And then he goes, "On the second page of Google," right? And everybody started laughing because he's right. Like, who goes to the second page of Google when they do a search? No one. That's why you hide the dead body there, right? So if you need help with your internet, go with Jeremy. If you need help with direct referral marketing, there ain't nobody on the planet who knows more about that than me, all right? Home Care Evolution, my company, we're here to help you. Come to the boot camp, all right? But if you need help before then, reach out to either one of us, okay? The next thing that I'm going to take away from this Home Care Pulse report that came out back in May. Check this out. Thank you. The caregiver turnover rate increased significantly for the first time in 5 years. Now, I will tell you, from having had multiple conversations over the last 5 years with Todd Austin, who's now the CEO of Home Care Pulse, this year, 2018, was an anomaly year. It has consistently been about 65% year to year until this year, where it rose by 12%. And that's big. That's big. I mean, even the master's revenue per caregiver went down, as I showed you that slide before. It used to be $28,000. It went down to $20,000. So the turnover rate is there. I don't think it's an anomaly, but for you to calculate your own, what you want to do, and I teach you this at the boot camp for those of you who came, and for those of you who are actually clients of mine, I want you to write down a note for yourself. Steve goes over this in Momentum Class Lesson 1. In Momentum Lesson 1, this is where I teach you how to calculate this and what your KPIs and everything else, all right? But for everybody else who's not a client of mine, I want you to check this out right here. The equation that you want to use to calculate your turnover rate is real easy. How many people quit or you fired last year as caregivers? What is that number? Divided by the average number of people you had employed during that period of time. how many people were fired or terminated, divided by the average number of people employed, that equals turnover rate. Being as important to the bloodline of our business, caregivers are, we've got to do better than 77%. We really do. I can and do how do I know it can be done? Tomorrow, I'm literally driving to one of my clients' offices in Connecticut who has a 22% turnover ratio. That means that for every 100 caregivers he hires, a year later, 88 of them are still working for him. He only lost 22 of them, right? And there's some things that go into it. One thing, I'll throw some tips out here for you. One thing, stricter hiring process, meaning more hurdles. And I know that sounds like, whoa, 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 Steve, wait a second. I can't get caregivers to work for me as this. You mean you want me to make it harder to get them? At the end of the day, it's worth it, because if it's harder, you will help to discourage the people who would quit anyway from ever working for you, which will make it easier to retain them. A big part of the marketing that I talked about in that last slide, bringing in nerds. When you bring in a nerd, remember the N in nerd is need. Remember the D in nerd is disabled. So you're bringing in a great need disabled patient. When you do that, that person needs somebody who can handle them. You and I both know that when you put a caregiver who's brand new that you don't know well into a medically complicated situation, you lose sleep. You know you do. Because I know I would, right? Because I got this sick patient, I got this caregiver that I don't know going in there. On the flip side, referrals equals freedom. When you're bringing in caregivers and you have really strict interviewing processes, but then you're bringing in truly the best of the best, you get them working and you bring in an abundance of referrals. As soon as that case ends, you reassign them to another case at the same hours. That's part of what you're able to do when you have a 20-hour minimum. There's only so many shifts that exist. For those of you who are my clients, Momentum Lesson 6 is where I talk to you about staffing and piecing the cases together. There's only like 12 different possible shifts. So it's very easy to sell the 20-hour minimum around the shifts to keep your caregiver. But then now, back to the nerd, the great need disabled patient, right? Elderly resources. You now assign a caregiver that you know what they're capable of. They've worked one or two clients for you. Not only does that help you to retain the caregiver, it also gives you peace of mind because you know this caregiver can handle that medically complicated patient. This is the reason why I know you can get that number down. Now you see these three companies right here. They're going to be at the boot camp. All right, this is actually called Engage. It's just spelled funky, right? Engage is how it's called, Engage, right? And so what they do is they actually help you with the interviewing of caregivers. So if you need help with it, give them a shout. Viventium is a payroll HR company that can help you with managing your caregivers and making sure they're paid on a timely basis. If you need help with it, reach out to Viventium. And then of all the three, the one I know the most is my good friend Elizabeth, who's the owner of Care Crown, and she's got two other business partners. They are a retention tool that helps you to create a reward system and a recognition program to retain your talent. So all three of these companies, they're going to be at the boot camp, and I want you to come and meet with them. But if you have an issue in this area, this is what I love about this, right? Here's the issue, here's how to overcome it. And if you need help with it, here's where you can go to get help with whichever one or all three parts of it that's frustrating you and challenging you right now. I highly recommend you reach out to any of these companies to help you. Many of my clients work with some or all of them right here. This next one right here is another thing that I noticed, right? And I actually mentioned it in my article right here that came out a couple weeks ago in the second quarter, the summer issue of Home Care Evolution Quarterly. But this right here, I noticed that we are way too staff heavy, way too staff heavy. All right. This position right here, dedicated intake personnel, this is not necessary. The only exception, if you have a home health or a hospice business and you're bringing in 20 or more inquiries a week. If you're a Medicaid business and you're bringing in 20 or more patients in a week, then yes, you will need a dedicated intake person who handles new inquiries. That's the only exception. 20 or more inquiries in a week. If you're not doing it, if you're not doing it, that responsibility should go default to the sales rep. That's the truth, right? The sales rep, if I'm not marketing and I'm the one representing the company, people are referring my company through me. So they're expecting me to meet with the prospective clients, and most people are bringing in like 1 or 2 inquiries a week. You know, some good companies out there are bringing in 3 to 5 inquiries every single week. That you don't need a dedicated person for that. So I feel like this is an error, or this is because Home Care Pulse has the home health, the hospice, and then a lot of Medicaid. So again, if you're bringing in 20 or more inquiries, then you need a dedicated intake person, because it's too much to put that on your marketers. All right. But if you're not bringing in that kind of volume, this is not a position. And I'll be real. I don't care if you're home health, hospice, or Medicaid. If you're doing less than $1 million in revenue, you're deficit spending. You're spending too much money because you have a marketing rep and you have an intake person. There's no way, unless every single client you're bringing in is getting 2 hours of care. That's the only way you could be generating less than $1 million in revenue and have the need for an intake person. So be careful with being overstaffed, all right? Another thing I want to point out here, for these 2 categories right here, you really should not have an executive director. I don't like people having a sales rep until they're around $1 million, because a sales rep is a high salary. It's one of the higher salaries, right? So in order to afford the marketing rep, you need to be bringing in 6, 7 figures. That's where the revenue comes in. Business owners should be able to run the company and market the company themselves until they get to $1 million. Almost all of my clients operate that way. The only exception would be the client who is investing in having the position of need before they have the revenue to afford it. I've had several clients come to me. They're like, Steve, I'm going to open this business. It's going to cost about $50,000, $60,000 to open it and get it going. And I'm going to spend $200,000 in my first year by having a full staff to be able to get it to break $1 million in its first year. Can I do that? The answer is yes, you can. You won't make that money back until your second year, and really your third year is where you're really going to start to become profitable. But yes, you can do that, and that's when I would recommend doing that. Other than that, if that's not you, you as owner should be doing this and this and this yourself, which now means, yeah, maybe 1 care coordinator / scheduler, 1 field supervisor, and 1 admin. Owner and 3 other staff members, that's all that's needed for the less than $1 million crew. All right, $1 million to $1.5 million, maybe 1 more position, add the sales rep. That's it. That's it. You don't need to get to higher numbers of staff until you're over here. All right. So I'm just this is where I was like, I'm looking at this like, why is the profit so low? And then when I see these numbers here, I'm like, whoa, this is way too many positions. We don't need all of that. And I'm not saying fire anybody. That's not what I'm saying. But understand, there's more workers than there's work to be done. Get the referrals coming in, get the caregivers, and grow your business. You need to grow. You need a catalyst. All right, that's what this is saying to me. All right, masters, everybody over here in these categories is pretty good, right? You probably will need 2 schedulers at this point, because now you're talking about managing 50 plus patients and so on and so forth. By the way, the Advantage Recruiting Group, the reason why I have them here is they're a great company that helps headhunters for like professionals. So if you happen to be looking for an executive director, they can help you. If you're looking for a sales rep, they can help you. So they're looking for more of those professional, polished office positions, not caregivers, but the people who run the organization. They can help you get the person you need. Next, this is the one that blows my mind. It blows my mind. For 12 years now. Wait, is it 12 years? 14. For 14 years now, the Home Care Pulse has been coming out. And for 14 out of 14 years, Home Care Pulse has done this exact stat. And every year it seems to get worse and worse. Like, it blows my mind that there's still businesses operating out there that don't track every one of their inquiries, especially since your software does it for you. If you're putting it in your software, you can run reports to get your inquiry conversions, right? But look at this is, again, how do I increase profitability, Steve? How do I increase revenue without raising my prices? That's what how do you finish the year strong? Take a look at what we're doing and what we're not doing. And let's do what the people who are making the most are doing so that we can finish strong and grow our business and have a great Christmas, right? Merry Christmas, right? Let me tell you something. I always have fun. I love you guys. I'm a cornball. Okay, I'm a cornball. So anyway, check us out. 2019, not too much of a difference. 2020, big difference. 2021, big difference. 2022 somehow got worse. Like, I don't know, the pandemic, people got lazy, maybe too much business was coming in, so we took our foot off the gas or whatever. But I'll tell you right now, with the economy, people are tightening up, people are watching what they're spending. All of a sudden, it's becoming harder to convert. So I expect next year this gap to be even greater because there's so many folks out there that are not tracking the revenue. But look at this, right? The companies that do not track their revenue who were surveyed averaged $825,000. The companies that are tracking their revenue, every inquiry, averaged 150% more at $2 million, right? I think that numbers are correct, right? 800,000 times 150% is $2 million, right? That math works out. This is tried and true. And so with that being said, there's two companies I work with. SwiftOps, I absolutely love. What I love about SwiftOps, they're going to be speaking at the boot camp. What I love about SwiftOps is Bruce, who's the founder of it, used to own a home care agency. And so he knows from an owner-operator perspective what people are looking for. That's why I like SwiftOps. Why do I like SmartCare? I like SmartCare because SmartCare has the customer service. Customer service. At the end of the day, I talk about this all. I literally spoke at a marketing conference last week for 1,000 people, right? My website this week partly blew up with international people because there are people from Tokyo, people from Saudi Arabia, people from China, and all over the world at this conference I spoke at last week. I spoke on branding, and I also talked about all the over technology and how technology is advancing faster than we can. And the companies that focus on good old-fashioned customer service, pick up a phone and call somebody, I think are going to really thrive in the next 10 years because so few people have gotten away from it. SmartCare, they have the old-fashioned way, and I love that. So these are the two companies I recommend. If you're not using either one of them, demo both. Go with who you feel most comfortable with, but either one is going to be able to help you do it. But again, most importantly, we've got to track our inquiries because we're leaving money on the table. If you're not tracking your inquiries, you are leaving money on the table. All right, which brings you to the next one. Revenue. Payer sources, right? Good, I'm right on time. I'm right on time. This is awesome. I hope you're getting a lot out of this. All right, payer sources. The one that stands out to me, and for those of you who are clients, I want you to write this down, Steve's clients, that inquiry tracking, the last slide, let me go back a slide. This one right here, I teach you that in advanced training lesson 3. So clients of mine, write down advanced training lesson 3. That's where I teach you inquiry tracking and how to do it in-house. Then you can work it and put it into your system and everything else and run the reports through your software, okay? Advanced training lesson 3. Now back to the payer sources. I want you to write down home care special ops, lesson 6. So if you're a client of mine, home care special ops, lesson 6, okay? That's where we talk about payer sources and getting paid and everything else, contracts, all this other good stuff. But specifically, when I look at this and I see the revenue coming through and I see that most of the agencies surveyed, the majority of their revenue comes from private pay, and that's totally fine. That's cool. That's how it should be, all right? You're a private pay business. All right, Medicaid is also up here as well. If you set Medicaid, that makes sense too. But the part that blows my mind, we are leaving money on the table, is long-term care insurance. As a matter of fact, the trend is a slow decline over the last 3 years. All right, the last 2 years it's been pretty much the same, but it dropped about a full percent. And this is where it's very, very challenging. All right, so the biggest tip I'll give to you now from my clients, I spent a whole hour teaching you how to do this in special ops lesson 6. But for those of you who aren't clients, the biggest tip is to accept the assignment of benefits. At my company, CareChoice, I'm so nostalgic. My company, CareChoice, back in the day that I used to own, my private duty home care company, more than 25% of the $5-6 million a year in revenue that we were billing out when we sold the company in 2011 came from long-term care insurance. When I sold it to Senior Bridge, a significant portion was coming from long-term care insurance. Some of the biggest companies I've worked with, one of my buddies, one of my good friends, Stephen East, who used to own a large private duty home care company in Manhattan, right? He used to. I think he sold and he moved away, I believe. But when he owned it, he spoke. The first time I met him was when he spoke at a conference that I was also speaking at in Las Vegas in 2014. And his multi-million-dollar business had 25 to 35% of his revenue coming from long-term care insurance. There's an entire franchise. I'm not even allowed to say the name of the franchise, but more than 40% of their revenue comes from long-term care insurance. When you have over 1 million Americans that have long-term care insurance policies, if you're not tapping into it, you are leaving money on the table. And the best way to tap into it is to accept the assignment of benefits. What does that mean? That means that instead of it, because here's what everybody does. Everybody, I'm telling you right now, people say, Steve, I do this. And I'm like, great. And that's the reason why you only have 10% of your revenue coming from it, right? Everybody bills the patient pays you, you help the patient submit the invoices, and then the patient gets reimbursed. The reason why that's not working, and the industry trend is showing it, is because nobody wants to do that. By default, I will tell you, when I used to go marketing myself back in the day, I used to go to my referral sources. And when the social workers found out, in every hospital, every nursing home, every assisted living, the one thing they all tell you is nobody can afford it. No one. Whoa. It's $100 billion a year industry, right? It's a lot of nobody's affording it, right? But every social worker says the same damn thing. Nobody can afford it. But as soon as you say you will bill the long-term care insurance if somebody has the policy, they go, what's your information? What's your number? I'll send you every long-term care insurance patient I have. And that gets your foot in the door to get all of their referrals, because they start referring you because no one in your market is accepting the assignment of benefits. That's how it's done. That's how it's done. And I can go on and on about this, but that is the easiest way to do it. Now, yes, do you have to float the money that you're paying the caregiver? Of course you do, but it takes money to make money. You just got that big fat ERC money, right? You just got that big fat PPP loan, right? If you got over 100 grand, you can float the money. You shouldn't have spent it. Hold on to it, float the money for a little bit, and receive it back in full and then some. You could even, there's other things I teach my clients on this without, I don't want to get into too much because there's other slides I have to get to, and I don't want to keep it to the hour here, but there's so much I teach you on it. I mean, you have to do more work for it. You really do. You have to do extra billing and extra paperwork and stuff. So you build it into the price. You work more for it. You just pass it on. Like, there's so much you can do, and it's profitable, and they're paying you your rate. Why this number is going, again, 25 to 30% of my revenue is doing this. My top clients who are doing it, 25 to 30% of their revenue is coming from it. Do you have to float it for a little bit? Yeah, you do. There's ways to go around it. But again, this right here tells me opportunity for all of you who are on this webinar to turn things around and get things going in the right direction for the second half of this year. By the way, one last thing I want to throw out here. You see Legato Living? This is something that I love it. I love it. Like, people ask me, Steve, if you were to get into another business in healthcare, what would it be? I don't want to get in. I have investments. I'm doing stuff on the side. I actually just bought into a hotel earlier today. I'm excited about that. This is my first hotel. But I'm not going to do anything else healthcare other than be a consultant, right? But if I were to ever go back into it, I would 100% do a small group home for memory care. When you look at all the different companies that exist out there, Potomac Homes, Sunrise, Brandywine, and this other small group model, it works. You have higher faculty or higher staff to resident ratio. The building is a fixed cost. Maintenance, you don't need a lot of staff, 8 to 12 people or whatever. So what I love about Legato Living is they're a brand new franchise that can help you do that. So if you're looking to add additional revenue sources in the same healthcare space, you may want to consider looking into Legato Living and getting a small group home to kind of go with your private duty, and maybe even have clients build waiting lists and whatnot. So there's a lot that can go with it, but I just mention it here because it makes sense as we're talking about multiple payer sources. All right. And then the last one before we wrap up here, and I give away my prize and I do your Q, answer any of your questions here before we wrap up here for the summer, is your conversion ratios. And I can't stress this enough, because when I look at this, this is one of those things that that jumps out to me as a consultant, but it also jumps out as this is something that's 100% within your control, right? You all have the ability to be able to convert. But what is the difference between the masters and the non-masters? Because this is big. 25% conversion, 33. 33 is not bad. 30%, 30%, but 40%. What are the masters doing that the other companies are not doing? As a matter of fact, I'll go as far as to say most, not all, but most masters are charging more for services than people who are not masters. Wait a second, Steve. That doesn't make any sense at all. You mean to tell me that they're charging more for services and they're converting at a higher number? What's the difference? It's called systems and processes. That's what it is. Here early on, most of the time the business owner's doing everything him or herself, and they're just so busy and overwhelmed they can't handle everything. That's why it's so low. It gets a little better over here as you start bringing in more help, and it kind of stays in that 30%. But you still haven't mastered the process. A lot of business owners also, and it's not an ego thing. It's not an ego as much as it is trust. We really need this patient. I'll be the one that, I don't know if I'm going to trust this to just anybody else. But over here, by this point in time, you have to trust other people because your business is so big, you can't go see every other person. So you have seasoned reps, you've invested in training, you've gotten support. If you're a client of mine, I want you to write down advanced training lesson 4. That's where I teach you how to close a prospective client. All right. So advanced training 3 is inquiry management. Advanced training 4 is where I teach you how to close a client. But there is no reason why any person doing less than $5 million cannot have a 40% conversion ratio. It's real easy. You got to have somebody who's good on the phone, a process so you can duplicate it. And it's not just one person, because what will happen is the one person is going to be on the phone, or they're called out sick, or they're working from home, or whatever when the inquiry comes in. So you need to have everybody trained on how to properly answer an inquiry. Then the second step is you schedule an appointment to go meet the person. I know during COVID, a lot of folks got lazy, but that's also where a lot of people's numbers have gotten worse since COVID. These numbers used to be better in 2019, all right? I'll tell you that. So we stopped doing the assessment in person, and then you try to sell them over the phone. That used to work, that's great, but you don't want to do that. You don't want to do it. Why is our caregiver turnover ratio 77%? Well, if half of us aren't even walking in the house and seeing what a caregiver has to work with every single day before they sign them up, you could be walking into disasters. I will never forget, for as long as I live, I must have went into 2,000 different people's houses during my 7 years when I had my agency, right? And I will never forget walking into the houses that looked like they should be on Jenny Jones and Condemned. And you got to call ServPro, Adult Protective Services. I went into one house and there was so much mildew in the bathroom and so much mold in the bathroom, and they wanted to live in. And I'm like, we got to get this house cleaned before I send anybody into this house. I'm not going to send my worker into this dangerous, hazardous environment. You're a senior. I can't leave you in this environment. You have this pre-screen. Plus, think about what I'm telling you to do. Nerds, right? I just talked about getting nerd patients. Great need, disabled. They need a lot of help. You need to see that person before you just send a caregiver into that house. That's how you get good cases. That's how you keep good caregivers. So inquiry process, goal, schedule an appointment, consultation, sell and close the case, set it up for start of care. That's the process, all right? And everybody, again, who was a client of mine, advanced training 3 and 4. And I'll also mention Home Care Special Ops Lesson 2. That's where I teach you how to properly open up a case and set it up for long-term success. All right. So just writing it out there. So again, everybody, there you have it. Super excited about this. All right. The Millionaires Boot Camp. I hope to see you all there. It's going to be an amazing, amazing event. These are just some of our speakers that'll be there. Again, thank you to all of our sponsors for this webinar, helping us to promote this. You will get a chance to meet all of them at the boot camp. If you need help with them, don't wait until then. But if you come, you'll see them. If you're considering things at the end of the year, it's a good time to take a look at everything that's on there. So all of these companies will be represented at the boot camp. We hope you can make it to the boot camp. Some of the topics at the event before I give away my free giveaway here. Hospital marketing. Now, if you've heard it before, I've redone the entire thing, so it'll be new to you. Make sure you hear it. Get referrals from hospitals. 7 steps to freedom in your home care business. When your business is running you, you can't run it, and you're stressed out. So I'm going to teach you how to remove yourself from the day-to-day operations as a business owner at this event. That's phenomenal, all right? Aligning your caregiver and operations to boost business growth. Recruitment and retention and operations paired together to be able to help you grow your business. Everybody says, if I had more caregivers, you can't afford to miss that session, all right? Building a preferred provider network. Steve, I need to get more nerds. You're right. I like what you said, 20-hour minimum. I need to get a steady flow of nerds coming in. You're going to need a preferred provider network to be able to master that. I'm going to teach you how to do that. And there's other processes, other programs. Again, don't forget about Captain Dr. Joseph Couture from the United States Navy coming in to talk about what veterans are looking for, what we're doing for our active military. It is going to be an amazing presentation. We're going to hear about AI and how it's affecting the home care business at this conference, and so much more. I cannot wait to see you at the Millionaires Boot Camp this November 15th through 17th. All right. So that said, you can go to the website. You can save early bird discount right now and in a couple of weeks. But I want to give you all something. All right. To one lucky person, and let's see where it says questions. All right. Oh, good. Everybody's still here. I don't look at the go-to webinar stuff. I just start talking. So I'm glad that you're all with me still. I'm going to write a number on this. And the first person where it says questions to guess the number that I'm going to write down here is going to win a free prize. Okay. $1,000 prize. Ah, Christina Ramos, look at you cheat. It's 1 through 10. It's 1 through 10. Okay. I just wrote it down. No one guessed it yet. I said 1 through 10 and no one guessed it. Yay, I got a winner. Okay, I finally got a winner. It was so funny. I see all the numbers coming in. Not a single person had guessed it yet, right? So this is the number. Number 2 was the number, right? And the first person way down on the list here who guessed number 2 is Michael Mitchell. Michael Mitchell. All right, so Michael Mitchell, here's what I want you to see the phone number on the screen, the 848-444 number. I want you to give us a call. I'm going to give you a free rapid results kit that you can use right now. And that rapid results kit comes with a free boot camp ticket. So you got a ticket secured to come to the event. It's actually $2,500 worth of stuff. You get a coaching session, you get a $3 million business plan in there, you get the power partner training, you get the art of closing training. So some of the things I talked about on this webinar will be included in the rapid results kit, and you get to come to the boot camp. And I'll tell you what, for every one of you who are on here with me right now, if you buy a boot camp ticket this week at early bird, I'm going to throw in the rapid results kit for you for free. That's my thank you. So if you get a boot camp ticket this week only, that's it. This week, you get a boot camp ticket this week by going to the website. I'm going to give you a rapid results kit. This way you can get some help with things to grow your business now. And then when I see you at the boot camp, we'll just continue your training in November. All right. So go to the website, homecarevolution.com/bootcamp, get a ticket, you get a free rapid results kit. All right. And so now let me see if I have any questions, and I'll answer your questions throughout the rest of our time here. All right. You guys are so funny. I had literally you guys guessed every single number except for 2. except for 2. That was hysterical. All right. And the first person was Michael. There was a couple people who said 2, but it was later on. Michael Mitchell was the first one. Okay. So Linda from Chicago, having a bright star day. Love it. Saying hello to everyone from St. Croix in the United States Virgin Islands. I love it. Is the boot camp more about hitting 1 million? Would it be relevant for companies already? This is the millionaires boot camp, so it's going to be high level. So if you're already doing $1 million, that's like the minimum I would want. Some people who aren't doing $1 million, you can definitely come, but it's going to be, it might be over your head, but that's not bad either. But if you got $1 million business and beyond, you definitely want to be here. I'm going to talk about, again, regional preferred provider network, how to get into hospitals, scale it to $5 million to $10 million. That's going to be a big primary focus. If you remove yourself as a business owner from the day-to-day operations, you're going to need executive leadership in there. So you have to be generating a certain amount of money to do that. So I see somebody said that, they want to, if I'm already doing 3 million, is this worth it? This is the event for you, right? Like if you're doing $3 million, you want to get to 5, you want to get to 7, you want to get to 10, right? This is the event for you. Okay. It's the millionaires. So it's millionaires as in how to generate $1 million for the owner of the business, right? That's a huge business, right? No longer a small business. So it's going to be huge. Can you put the PowerPoint into PowerPoint mode? I think that was because of, I pulled it out when I was doing so. I put it back in PowerPoint mode though, so we're set there. Truth. Oh, this is somebody who read the book. Carrie was talking about how she studied Ruby Payne in education in a leadership job that she has, and it carried over into home care. I can't stress this enough. This book, I wish it existed when I had my agency, because it was very eye-opening. I mean, I was good with my caregivers. Because I had an abundance of referrals coming in, I was able to constantly keep my caregivers working and transition them from one client to the next. But this one picture I'm going to show you in the middle of the book, in this one picture in and of itself alone is worth the $17 for the book. And this is where they talk about different priorities that everybody has in their life and how it affects people who are poverty, who have middle class background and mindset, and wealth mindset. For example, when it comes to like material, when it comes to possessions, right? People who are wealthy, they value possessions that are one of a kind, right? One of a kind. Like I have this collector's edition, 1 of 1,000 Ultra Instinct Goku Super Saiyan, 1/100th lifetime size, statue of Goku on my desk, right? That's there's only 1,000 of those. Right? I got a picture of Superman on my wall that somebody gave me. There's only 100 of them, right? That's the wealthy. They value that more than anything else. For the middle class, they value the things that they're able to get. Now, it's not that they don't value people. It's not that they don't value other things, but it's that their goal is to acquire more things. I want to get a new house. I want to get a car. I got to get new clothes. I got to go to the mall. I want to go to see a movie. The things I can buy with my money. For the poverty, they don't have anything. So the only thing that they value are people, because they don't have any disposable income. So, and it's not that the wealthy doesn't. It's not that the middle class doesn't, because we all do, right? At either of these levels, of course we value people, but we have other things that we also value. But for the poor person, they don't have anything. So the only, like how many times have you talked to a caregiver and they're like, the only thing in my life that means anything to me is my son. That's the only thing that matters. He is the reason I get up every single day. Nothing else matters. That's something that you've probably heard a caregiver say. Why? Because she literally has a car that she probably paid $100 for. It's held together by glue and spit and gum and duct tape that breaks down every week, right? So she don't value that car because the car isn't anything, right? She only thinks she has a value. And it goes, I mean, how do they value time? Their destiny, right? The destiny one was one of the saddest. Education for the rich, it's all about necessary to make connections. For the middle class, it's all about climbing the ladder of success and growing my career. For the poor person, it's valued and it's revered, but it's considered abstract because I can't afford that. Go to school. Who's going to go to school? For a poverty person, they might be the very first person in their whole family lineage to go to college. Like that's putting in, and that this one thing right here is worth the cost of the book. So I'm glad somebody backed me up on that one right there. Highly recommend the book. Another question that I have here, the challenge that we're running into are clients wanting 2 to 4 hours. Our minimum is 5 hours a day, 3 days a week. So I love that you said that, Michael. You'll read, you're the person who won the rapid results. You'll read the $3 million blueprint in there where I talk about the 20-hour minimum in there at greater detail. But in a nutshell, there's a school of thought, and at the boot camp, I will go over this in much greater detail. But at the end of the day, it really comes down to need. That's what it all comes down to, need. If somebody really needs less than 4 hours a day, then they should not go with an agency. They should go with care.com and hire a caregiver directly through care.com or caring.com or one of the other sites that exist out there, because an agency isn't built to sustain that. And they also don't need the help on a regular, consistent basis. They need it more like a babysitter service or relief for somebody else. They can manage that. But when you have a nerd patient, this is why I talk about the nerd patient so much. Great need, elderly, resources, disabled, right? That nerd patient with all 4 of those parts to make up that client. When you have that nerd patient, they need help, and they need it every single day. They cannot go without care. So when you have an abundance of those folks contacting you, they're the ones that make it easy to sell a 20-hour case, because they're looking for 30, they're looking for 40 hours, 56 hours, 84, 168 hours. They're looking for that much level of care, which when you get an abundance of those coming in, you don't have to serve the clients that are very difficult to staff. Let them go with the services that are better suited to handle it. Because you and I both know a 15-hour-a-week client makes it very hard to keep that caregiver, right? Because unless it's very hard to get a 15-hour caregiver who's worked with one client for 15 hours. These are your hours that you told me, right? 15 hours a week, 3 days a week, 5 hours a shift. So that's 15 hours. It's going to be hard to build out a 40-hour schedule for a caregiver. And if you don't get that caregiver to 40 hours soon, that caregiver quits. When that caregiver quits, now you have to restaff the case with another caregiver and hope that they stay on there. That burns your reputation as an employer to the caregivers and to the patients, because you have a revolving door of caregivers coming in and out. This is why the 20-hour minimum is what works on there. So I'll go over in greater detail how to do all of this at the boot camp. That's why everybody needs to come to it, but it really is that important. Another question. Overall, this seems overstaffed. Yeah. Somebody talked about the overstaffing of it. It is. At the end of the day, can you tell me what the nerd stands for again? I just covered that. And I think that was the last question. Yep. And then just some people laughing at the numbers and people who are guessing numbers here. So let's see, anything else? Oh no, there's a couple more at the very end here. Wow, you guys asked a lot of questions there. It must have been, wow, Michael, you are in Manalapan? Oh my goodness. So you call the office, you can just drive here and pick up the kit. Brandon, will there be an option to stream online? So Brandon, I'm gonna say no. The reason why I don't do an option online is because it didn't, I've tried it, and if the internet cuts out, it leaves it so that it's not well. Plus, there's so much interaction. I'd rather you come versus not come and try and watch it at home. It just doesn't work out. I do this at my church. I'm also a minister, and I preach, and it is very difficult to control a live in-person audience and a remote audience. It's almost contradictory skill set, and one ends up getting left out. So I tried it, didn't work, so it will not be live streamed. Come to the event. It's worth 3 times what you paid. It really is. And plus, how fast I speak, you'll get 3 days of content. You'll get 3 days of content in the first day. Jason says, best thing to focus on for a lunch and learn at a hospital. Wow, great question. So for those of you who are clients of mine, I talk about lunch and learns in Fast Start Lesson 6. All right, so specifically, I teach you how to do the 25-minute lunch and learn. Fast Start Lesson 4 is where I teach you how to create specialty programs that you can differentiate yourself from your competitors. So that's all in your Fast Start, where I teach you how to do that. Jason, I'm going to assume you're not a client of mine. So what I would say the best topic at a lunch and learn at a hospital is, what is the pain point of that hospital? What are the type of patients that they have the hardest time dealing with? What is the type of patients that they have high readmission rates for? And the reason why I say that, because all that information is free on Medicare.gov, and you can find that and pull it up and then get the research there. So that's, if it was me, that's what I would do for a hospital without knowing the hospital. Is this seminar for business startups? Our Letha is asking, is this boot camp for startups? I would say yes. And here's the reason why. Although it's the Millionaires Bootcamp, although a lot of the conversation is going to be built around people who have existing businesses, if you're in startup, don't you want to know how to get to that point as quickly as possible? Don't you want to know what the people who are where you want to be are learning? And it'll help you to get there faster. So I'm going to say yes. Have I had startups come to the Millionaires Bootcamp before? Absolutely. And they come and they're just completely blown away, but it changes their trajectory. So imagine you're in startup and you really don't know home care yet. You're still learning it. And then you come to an event that's advanced for you. Now, all of a sudden, it's going to get you through that learning curve much faster. Instead of spending 3 years to become really profitable, you could do it in 12 months. I've seen it happen before. So yes, I will never tell a startup not to come to the Millionaires Bootcamp. It's going to be advanced, but again, learning advanced techniques early on is only going to get you to that level much faster than doing it on your own. And time is money at the end of the day. All right, Steve, is there a price just for the fast start if we're not able to attend the boot camp? Yep, absolutely, Brandon. On our website, you see it says boot camp. Just drop off the boot camp and just go to the website homecareevolution.com and schedule a demo. And you can speak to Scott, who's our director of business development, and he can go over, get you set up with just the fast start or the Hurricane University or whatever it is that you'd like if you can't make the boot camp. I would love for you to come, but I understand if you can't make it, we're here for you. Linda, please put the title of the book in the chat. I keep missing it. It's a framework for understanding poverty. A framework for understanding poverty, and the author is Ruby Payne. All right, I'll type that in a couple seconds here for you. Steve, is the price just for the rapid results if we're not able to attend? Yeah, the rapid results is normally $1,000, but if you want it and you can't attend, reach out. I think I see Scott already reached out to you. He can go over, get you the rapid results kit, and you can hold the ticket for another boot camp in the future. I'll honor that. All right. Barbara says, what are the 3 staff you need if you're under $1 million in revenue? Great question, Barbara. So what I recommend is the owner does the marketing and all of the operational functions. You should have a dual responsibility of a recruiter / scheduler, and then you should have some kind of oversight field manager who's managing your cases, visiting your caregivers, supporting them, and keeping the cases going. And why do I say that early? Because a lot of people say, shouldn't I wait to get a field manager until I'm going? But I'd say when you get to like 8 to 10 clients, you should have that field manager, because by you having the field manager, that's a big missing gap. And Barbara, I think you're one of my clients. So home care special ops, lesson 1, 2, 3, and 4 is all about the field manager position, how to create the position, the responsibilities, how to execute those responsibilities and everything. So special ops 1, 2, 3, and 4. So Barbara, just make sure you take that class or review those. That's how you do that. But what I love about that particular position is that will help to significantly increase your caregiver retention, and it also increases your client longevity. At the boot camp, I'm actually going to talk about increasing client longevity, right? So happy clients stay on services longer. Caregivers that are given the support that they need work for you longer than caregivers that aren't given the support. So by having this position early on in your business, that will help you to retain your clients, which makes it easier for you to stack your clients and grow your patient census. When the patient census is growing faster, revenue will also grow, and that'll get you over the $1 million mark much faster. So business owner, a dual scheduler / recruiter, admin type person, and some kind of field manager, field supervisor. Those are the 3 positions you really need to get going. If you want to have a 4th person, maybe split the scheduling and the recruiting, but share some HR, share some other admin type stuff, answering the phone, filing, data entry, that kind of stuff for the 4th position. But you should be good on those 3 until you get to $1 million. Then you can hire your marketing rep and dial it back a little bit yourself as the owner. All right. Next is Joseph says, if I'm a new home care company, should I attend the boot camp? Yep, definitely. Will a recording be available to go back and visit this again if we have missed today? Yeah, we're going to email that to you tomorrow so you can get the recording. Is the hotel available now? It should be available now on that site. You go to homecarevolution.com/bootcamp, and the hotel information is there. Great info. I have to leave. I have another appointment. No problem, Pamela. Hopefully I see you at the boot camp. Thanks for answering that. I'll give Scott a call. You got it. Have you had experience marketing to brokers who write the private long-term care contracts? So Stephen, yes, I have. Yes, I have. I've spoken to some of the brokers. I've also spoken to many of the long-term care providers. And so once you start getting clients with long-term care and you help them open up the claim and whatnot, start to speak to the person who's the claim agent and ask them to put you in touch with the people who are responsible for all of the claims in your area and how you can get listed on their preferred provider list so that when they have somebody who comes to them first, they call you immediately. So there's ways to do that, and that's the best way to do it, Stephen. That's a very good question. I love all these questions, but some of these are great. Kat says, I've attended your boot camp in 2017, even before I started my company. Yeah, Kat, right? Kat's one of my successful clients who's crushing it. She attended the boot camp before she opened it. And that's something I recommend too. Like I've had several, Kat, you brought up a really good point there. I've had many people over the years do that. And it makes sense. Like think about it. Right now, early bird tickets are $7.99. Right, and if you do VIP, then it's $1,300, but it includes all your meals and everything else. So it's worth it to do the VIP, unless you're gonna leave and come back and stuff, whatever. I try to make the boot camp as low priced as possible, right? So full price ticket's $1,000. The early bird is $800, so you save $200. That pretty much covers the cost of the venue, right? The hotels are astronomical right now. Everything is astronomical. AV is astronomical, but I do that because I want to make sure that you're able to come. Now think about it. If you're thinking about starting a home care business, why should you come? Well, $1,000 ticket, flight, hotel, meals for 3 days, $2,000. I would rather invest $2,000 to learn about the industry and say, you know what, I don't want to do that, versus invest $100,000 to open it, get through the first year to realize I don't want to do that. On the flip side, invest the $2,000 to see how it's done. Maybe invest a little bit more, work with me or other companies that are there to help you get going, and then you do $1 million in your first or your second year, versus trying to figure it out and take 3 or 4 years or 7 years or 10 years to do your first $1 million. That's literally how it works. That's the reason why I've been in business as long as I have. So Kat, thank you for saying that. I just took a photo of the book. I'm going to buy it. Thank you. A virtual assistant can help with the cost of admins. Absolutely. Some managing remote workers. There's actually a new course coming out for those of you who are clients of mine. We're putting together a hurricane grad school to go with the university. So it's like you finish the university and then there's 4 more courses on the grad school. But one of the courses I'm going to be filming in 2 weeks. So much work goes into making these classes, but I know you guys appreciate them. It's called Managing Your Staff, and it's a 6-lesson course on managing your staff. And one part is manage yourself in the beginning. Another part is manage internal office staff. Another one is manage your external workers, which I would throw virtual assistants in the external workers, but also your marketing reps and your field supervisors, people that you don't see every single day. And then the last part is managing the entire organization from a 10,000-foot overview of it. So that course is called Amplify, and it'll be available later on this year as part of the Hurricane Grad School. So that's coming. But let's see, any other questions here? If you're a new agency, what should be the target focus group to get referrals? There's so much. Power partners. Always start with power partners. It's very hard to get into a hospital. And if you do get into a hospital and you mess it up, they're not going to refer you again. It's very hard to get into a skilled nursing home. It's very hard to get into an LTAC. It's easier, I don't want to say easy, but it's easier to get into a home health company. It's easier to get into a hospice company. And they're part of what I call the 3-legged bar stool. And if you make a relationship with them, you're all taking care of your patients in the same place, in the home. And so you can refer them, they can refer you. I always talk about making it a 2-way street. And, I have one of my clients I was speaking to on Monday, yesterday, and he's finally living the power partnership where he's referring his power partners and they're referring him, and then they're sharing in lunch and learns. They're opening doors for him because he's a referring partner and he's doing a lot of events with them, and he's getting lunch and learns and he's getting referrals from other places that he never even thought he would even be able to get into, let alone do a lunch and learn and get business from. So everything starts with power partners. And for those of you who are clients, that's Fast Start lesson 3 and advanced training lesson 5. So Fast Start 3, advanced training 5, that's where I teach you the 2 parts of power partners. All right. And at the boot camp, I'm going to talk about how to create a preferred provider group, which starts with having a couple of power partners and then doing organizational objectives that lead to success for everybody. So there you have it, folks. I'm glad thank you all for staying with me this whole time. I mean, I went way over, but I ended it and then I answered your questions. On behalf of my sponsors, everyone who's live with us, thank you so much for helping to promote this. I hope that anybody who needs you, when I was talking about the different challenges that people are facing, and if your company is somebody who could help, I hope that you're getting inquiries from this as well. And then for everybody else, you know, I hope you come to the boot camp because it really is going to be amazing. This will be my 27th boot camp that I put together. And again, if you've been to one in the past, the Millionaires Boot Camp, I've updated all of my presentations to make it relevant to 2023 specific. I'm going to be delivering it in a different format. For those who came to the Home Care Evolution Boot Camp in May, you know what I'm talking about. I had so many people who came to that boot camp who were like, Steve, I've heard you speak before. This is on a whole other level. It's because of the way that we're delivering the content and the way that we're able to, you know, share in what I know works. I've literally worked with thousands of agencies in 6 of the 7 continents on this planet. Everybody but Antarctica we've worked with. This works. And if you come to the event, it'll be the best decision you made this year. So I hope to see you there. God bless. Thank you all. Be safe and take care of our seniors. Have a great summer. I'm off to Connecticut. Take care, my friends.